Hello, my name is John Rose, and today I'd like to take a closer look at one of the most interesting words I've ever seen to describe the disease process, according to our so-called experts. That word is diffusion, and what that word simply means is the escape of fluid from a higher concentration to a lower concentration. It has to do with osmotic flow. It has to do with ionic pressure. I talk about this a lot in my other videos about how when we go on a solid food vacation, we drastically change the ionic pressure in our colon, thereby creating what's called a retrograde flow, where the colon can now be used as a fontanelle to help rid the body of all the waste that's out there in our extracellular fluid, especially our lymph fluid. And to illustrate how this word works and how they use it to describe things, there are a couple diseases that use the word effusion in it. We have pericardial effusion, and then we have pleural effusion. Now, all that simply means is that there's fluid that's built up around either the heart or the lungs or in the chest cavity itself. And it's interesting when you see how they explain what this is. When you look up the word effusion, it says it's the escape of fluids from the anatomical vesicles, meaning the blood and the lymph system, and they escape by two means. One is exudate, and the other is extravasate. So there's exudation and extravasation. Those are the two main ways that fluids escape. That's their word. The fluid's escaping. They don't understand what's really happening. And yet, when you look at what the description is, let's say that, let's give these things numbers, or letters. We'll say A is effusion, and it's caused by exudation B and extravasation C. And when you go to B, they have two. And when you go to C, they have two. So A is caused by B1 and B2, or C1 and C2. When we go to B1, it says it's oozing. Well, that doesn't describe anything. But when you go to B2, it says, here's where it diffuses. There's diffusion. So now they're finally telling us what's happening. Things are going from a higher concentration to a lower concentration. But then when you go to C, which is extravasate, they say it's 1 and 2. 1 is infiltration, which is where this eventually leads. But then for 2, they use, and get this, they say effusion. So A is caused by B1 and B2, and C1 and C2, but C2 is A. A is caused by C2, which is A. Nope, see, doesn't even make sense. So that's really confusing in itself. And what even makes it more confusing is when you look up the word infiltration, it doesn't come out and say diffusion. It says it's permeating. Then you go to the permeating, then it says to diffuse through. So you had to go through several definitions to come back to the same conclusion, that whenever things are exuding or extravasating, then the fluid's escaping by way of pressure. There's too much pressure built up. And yet, these experts of ours understand the technical things of what's going on quite masterfully, but they don't understand the practical functions that these organs perform. They don't understand that the lymph system isn't getting filtered, and that's what's backing up, that's what's creating the fluids. So when you look at what's causing, what they'll say causes myocardial effusion, they'll say it's myocardial-itis, inflammation. Remember, folks, disease goes through stages, and I say there's 4 long-term stages, and I took that from Dr. Tilden's 7 stages of disease, when I said the first 2 are more like the causes and the last 5 are more like the effects. And I combined the first 2, and I'm thinking maybe I shouldn't, because when I started studying this particular condition, they were really explicit at saying that it's either caused by an irritation or an inflammation or an infection. So when you look at the 7 stages, according to John Tilden, it starts off with innervation, not enough nerve energy, that creates the toxemia. So it's toxemia-induced 5 symptoms. First one is irritation. The toxemia irritates something. The body responds with inflammation, then ulceration, then induration, then we got the tumors, the cysts, the fibroids, the nodules, and calcifications. So what they're trying to say is that the inflammation is viral induced or it's bacterial induced. No, it's toxemia induced inflammation, but it starts with the irritation. And where is the irritation coming from? Where is the fluids coming from? It's coming from those anatomical vesicles, the lymph system, and the blood. And then when they go into detail about how they explain the effusion, they always use blood as the example. They never point to the fact that it's the lymph system that is backing up. The lymph system is not escaping, folks. It's backing up. So they're using the wrong terminology. They don't even understand what's going on. So virtually almost every disease we have can be traced back to this diffusion, which is the word that describes what happens when our lymph system isn't getting filtered. It gets too much pressure. It has to let off steam. It backs up. It goes into the tissues it came from. And in the body's wisdom, it knows it to go to a place that can exit the body, like the nose and sinus areas, which explains the colds and flus. It can go into the lungs, and they call that pneumonia. And they also say pneumonia is now one of the causes for pleural effusion, when you have liquid around your lungs. So our experts go to the scene of the crime, and they'll say, oh, it's not complicated, there's no inflammation, there's no infection. That's another way they describe these effusions. It's complicated, it's uncomplicated. If it's uncomplicated, there's no inflammation and no bacteria chewing on that stuff, which is why they say there's infection. So they'll say that pneumonia is what causes the pleural effusion, and then they'll say the pericardial itis is what causes the pericardial effusion. Again, what they do is they go to the scene of the crime and they see all the other things that are happening and they think that they're the cause, just because of the consequence. They'll even blame cancer for causing the effusion. Again, the body goes through the stages, and it all starts when the lymph system is backing up. That's what creates the irritations, the inflammations, the ulcerations, the indurations, and finally that's what creates the tumors and the cysts and the fibroids and the nodules, the calcifications. And yet when you have a pool of acidic waste matter and it's burning something and it's causing swelling and it's causing other symptoms, they'll blame that as a cause of something else. When it turns out that just about everything that they say is causing our diseases ties into diffusion. It's our bathroom not being filtered, it's backing up, and it's no more complicated than that. I explain this in much more detail in Disease Mysteries Revealed. Be sure and check that video out, as well as my video on what is the healthiest diet for humans, where I explain how we have two groups of needs. We got to make sure that we satisfy all of our needs, and we have to make sure we understand how our 10 body systems work together with everything. And of course, the main thing you have to do is realize it isn't the germ, it's the terrain. We want to focus on changing the terrain. What's the best way to change the terrain? It's very simple. It's to take a solid food vacation on juices. Got a seminar on how to do that, 2-hour seminar. They normally last 4 hours, so I have 31 related videos. Check out the description box. You'll see a link to that, 32 videos for that. And I'll be sure and put a link to those other 2 videos I mentioned moments ago. And remember, it all begins by understanding this simple concept. It's not the germ, it's the terrain. You got to change the terrain. When you wake up to that reality and you do that, ow, you're in for a treat.